Okay, welcome team. Today we're going to have our ethics consultation, and we're here to speak about Mr. W, who's a 27-year-old with a diagnosis of HIV, depression, and chronic hepatitis C. He has a 6-year history of IV drug use and has recently completed his 3rd rehab program. He states he wants to be clean this time and will do whatever it takes, and that includes breaking up with his girlfriend of 3 years who has continued her drug use. He's been attending the outpatient program and is progressing well, and he's currently on antiretrovirals for HIV and an SSRI for depression. And I guess that's why we're here, because he's requesting a prescription for Viagra due to his impotence from the SSRI. So I'm going to invite Mr. W to join us. And I guess the first thing we'll do is just go around the room and introduce ourselves.
Hi, I'm Sarah. I'm the in-house pharmacist.
Hello, I'm Dr. Mullally, the interdisciplinary physician.
I'm Andrea, the primary nurse.
And I'm Laura, the nurse manager.
Okay, so I guess first if we can have your perspective, that'd be great.
Okay, so I've been coming to the clinic for quite some time, and I do realize that there's quite a history with me going through 3 rehabs and all. But I'm really committed this time, and I'd really like to stay clean. I'm not depressed anymore thanks to the SSRI. However, after breaking up with my girlfriend, I realized I would like to start dating, start building up a new social life, and the clinic here seems to really believe that I can have this future clean and sober. However, it's hard to date when I don't feel confident in myself, so I would really like a prescription of Viagra.
Okay, and I guess our team, if we can give our perspectives.
Yes. First of all, I'd like to say I really do empathize with your story, and I'm very supportive of your efforts to become clean. Unfortunately for the pharmacy, it's really strictly financial. We are bombarded right now with HIV/AIDS patients, and these, as you know, or as you may not know, the heart medications, the antiretrovirus medications are quite expensive. And we're really hurting from that budget-wise, and we simply cannot afford to supply specialty medications. Not just to you, to anyone, because if we were to provide it to you, we wouldn't be able to provide it to everyone, and that would be a social injustice. So in the sense of distributive justice, social justice, I would have to say that the pharmacy cannot do this. We just don't have the finances right now.
Okay, Laura?
I would have to say that I agree with Sarah. As the nurse manager, I have made a commitment to the unit and the organization that we will provide the greatest amount of good to the greatest number of people. In order for me to keep those promises to all the different teams that we employ here, it wouldn't be justice for us to supply you with a specialty prescription. I'm already stretched too thin. We're in a hard economic time, and for us to supply this prescription and pay for it, as it is very expensive, we would have to take away from some of the other clinics' fundings, like the hypertension medications or the diabetes medications. And since this is not a life-saving treatment, I really do not think we should authorize giving you the Viagra at this time.
Dr. Mullally?
Well, I'm sorry, Mr. W. I am adamantly against you receiving this medication. Honestly, you've hardly been sober very long. Perhaps if it had been 6 months, then maybe I could consider authorizing this. However, as it stands right now, the numbers of new HIV seroconversions are growing every day, and we have to take care of all of these people already with no budget. So I'm honestly glad that you're not having sex and infecting more people and bringing more patients in, because I can barely manage the patients that I have currently. You do need to prove to me that you're responsible. And I really don't want to argue with Sarah and her wonderful team down in pharmacy about this one, because it's hard enough for me right now to get a hold of the drugs that I do need for my patients, such as to promote sleep, to increase their appetite, and to manage their HIV. So I'm sorry, but I really do not see Viagra as a necessity at this time.
I must say that I disagree with all of you except for Mr. W. I have a tremendous amount of respect for what he's been through at this point, and I would I guess make you guys think that if he didn't have this diagnosis, would you consider it the same way? I feel like he's kind of being discriminated against, which is what our ANA Code of Ethics tries to get us to not do. I also like to argue that if he were to get this Viagra, he might be more likely to take his SSRI and not be depressed, which would make him less likely to relapse and cause further infection of the population by either sharing needles or participating in risky sexual behaviors. So I guess that would be my argument. So I guess our ethical question would then be, given these principles of distributive justice and they're going kind of against respect for autonomy in this situation, what decisions do we think are ethically justifiable in this case?
Well, first of all, I'd like to start off by saying I appreciate what you've said, Nurse Andrea. I have nothing but respect for nurses and the care that you give. You mentioned doing the best thing for the patient, showing respect, beneficence, that kind of thing. I want to make it clear that I am not supporting this, not because Mr. W has HIV/AIDS, because we don't have the resources, and in an effort to provide all of our patients with the same sense of respect and beneficence, I need to be fair to everyone on the same level. To make it abundantly clear that this is not an AIDS issue or an HIV issue, I have no problem filling a prescription that is signed by a doctor, Dr. Mullally, if she will go along with it. I have no problem filling that prescription, but I cannot pay for it. I cannot provide it for free. The resources are not available, and to respect social justice, I just cannot make an exception for Mr. W.
Okay, Mr. W. Well, seems that the pressing ethical principle here is your autonomy. And out of respect for that autonomy, I will compromise and authorize a limited prescription of 10 pills. However, it will have to be at your expense because I do want to uphold distributive justice. If you continue to show that you are adhering to your rehabilitation, then perhaps we can reconvene at a later date and discuss filling a full prescription for you.
I believe that is a very fair compromise because then we are still respecting your autonomy and we're giving you the opportunity and putting a limited trust in you that you're going to commit and follow your treatment plan, and at a later time maybe we can come back and reconvene after you've shown a commitment to staying sober, staying clean, staying on your medications. Maybe we can come back at a later time and discuss the issue when you have proven to us that you are committed to your therapy. So,
Okay, I guess that concludes this meeting. Thank you for your time.
Thank you.
thank you.